Well, hello, everybody, and welcome to Health IQ. I'm your host today, Jaye Chase, and I'm here with the incomparable Dr. Tenise Hordge. Welcome to the show, Tenise.
Thank you, Miss Shay. I am very happy to be here.
Thank you so much for even just thinking of us to even spend some time with us today. You are a subject matter expert on so many different things. I mean, we could talk about a super fantastic mom. We could talk about a super fantastic wife. We could talk about a super awesome daughter. We could talk about your project management background experience. We could talk about your engineering background experience. We could talk about so many different things. But the one that I love to shrink it down is to your summit that's happening this upcoming weekend. Why don't you tell the viewers about it?
I'd be happy to. So this week kicks off Black Maternal Health Week. And so our summit, the State of Black Maternal Health, really highlights what's going on here in the state of Texas. So my nonprofit, More Milk, which is a little play on word as an international board certified lactation consultant, I try to throw that in whenever possible. But a little bit about More Milk. So the milk is maternal impact, leadership, and knowledge. And while our focus really centers around breastfeeding, we understand that looking at maternal health as a whole, especially in marginalized communities and the Black community, we can really affect positive change as it relates to breastfeeding. So if we take a step back, the State of Black Maternal Health Texas really identifies kind of the social determinants of health that contribute to these high and infuriating and scary maternal and mortality, morbidity and mortality rates that Black birthing women are experiencing here in Texas.
Now, that is a lot going on. Now,
It's a lot.
for those who do and don't know, now, is this summit just for like healthcare workers or IBCOCs? Like, who can attend this event?
Yes, so I really want people in the room that can affect positive change. So when I personally think of Black maternal health, it can be very daunting. It can be very heavy. And so we have a lot of baggage, so to speak, that comes along with that. But I don't want that to be the mood of the room. I do want to acknowledge that that is there. I want to hold space for that. But I want the individuals, the birth workers, the allied health professionals, the community leaders, the activists in the room that can really put together a plan so that we can start executing positive, impactful change for this generation and the generations to come.
That is a word in itself, that type of impact. And a lot of people don't really grasp that when you think about the state of Black maternal health. You know, you think of, like you said, more of the daunting data and statistics. You don't think about the change, the impact that it could actually have as far as turning that around. And that's really what you want to provide with the summit. So why don't you tell us a little bit about some of the presenters that you'll be featuring this weekend?
So we have a fantastic lineup. So we're going to kick off this Friday with kind of a literal state of Black maternal health, Texas. We're going to talk about mental aspects of maternal health. We're going to be talking about that postpartum support. We're going to be talking about prenatally what we can be expecting. And then in Saturday, we're going to really dive into some more of the statistics, some things to identify to be on the lookout. We have a fantastic speaker from Texas Health Mansfield. She's going to be talking about innovative policy and advocacy as it relates to maternal health equity, right? And we all know that equity does not equal equality. We will have a breakout session where we're really going to be working on a communications plan. We have some categories that we've identified from the social determinants of health where we can affect positive change, some strategy, contacts, those types of things. It's going to be hands-on, bringing that corporate energy on into this summit. We also have a D9 and Jack and Jill panel. So this is kind of the kicker because people are always like, well, how does that fit in? Well, these organizations have been advocating for well over 100 years for children, our communities, and those are transferable skills. So we're going to have a discussion about how we can take those skills and advocate now in the maternal health realm and arena. We also have a fantastic speaker from Dallas Health and Human Services. So Misty Wadler is going to be chatting with us a little bit about building these sustainable community outreach programs, because oftentimes we see families in the hospital and that's it. You don't have a really good system outside of discharge. And that's an issue, that's a concern. And so the last thing that we're gonna end with is a connections panel, because one of the things I don't want individuals leaving this summit is not knowing where to send resources. There's so much crossover in the populations that we serve. There should be no reason for someone leaving the summit saying, oh, I have a family that has need XYZ. I don't know where to send them. So through that communications and connections panel, we'll be able to say, hey, I know that Bridges Safe House in Cedar Hill has these types of resources, or I know the Afaya Center in Dallas has these types of resources, so that we can better support the communities that we all collectively serve.
That's amazing. This sounds like a fantastic lineup. Now, you've given us a really great overview, but let's start breaking it down to someone, let's say in Chicago. What can she be doing as an advocate to help with the state of Black maternal health?
That's an excellent question. So be aware, be aware that this is, that there are these discrepancies. And let me just be clear that Texas in general has a lot to learn from maternal health. So we are not even on the national average, nowhere near that of the other states. But when it comes specifically to Black maternal health, that's where we really start to see that problem explode, right? Because it's exponentially different as a Black birthing woman. So someone in Chicago needs to understand what the literal state is, right? What are those stats? And then be able to identify, well, what are the contributing causes? And so one of the things that really pulls my heartstrings, but also irks me at the same time, is that anywhere between 70 and 85% of these deaths are preventable. So we're talking about systemic racism. We're talking about access to care. And access to care means transportation. So in the year 2025, people can't get to prenatal doctor's appointments or follow-ups because they don't have transportation. I, for one, live in a city that doesn't have public transportation. So how do we navigate these things? It's tangible. It's something that we can do. So people will be able to attend the conference, understand the stats, understand the social determinants of health, and really put pen to paper on actionable things like a car ride system or whatever it might be that we can really influence and get positive change. And that's for somebody living in DeSoto, Texas, or Chicago, Illinois.
Love that. I love that. Now, again, when we're thinking about how we can assist with impact, what can men do? Should they be attending this summit? Should they be attending a summit in their city? What can men do to assist?
All of the above, right? So the society likes to paint this picture that men are absent, especially men that have a little darker hue, right? So our Hispanic men or our African American men, and that is just not the case. They're there, they're showing up, they're involved, they're concerned about their birthing wife. They're concerned about the mother of their child. They're concerned about their child. They might not know the questions to ask. They might not know, the certain things that contribute to this poor healthcare that's within their control and what's not in their control. So coming to a summit like this will help to arm dads, fathers, uncles, brothers, cousins, right? These supporters with asking the right questions, being there to support, stepping in when your female relative, loved one can't. And so not only do we need our men to do this, we need our aunties and cousins, we need everyone to do this, but men especially, right? They carry that kind of weight. They have the deeper voices. They usually have these larger appearances that can't be ignored. And so we absolutely need them for that as well.
Um, Uh, we are all over with this summit. Everyone knows what the call to action is, but just in case they don't, how would you like to sum up what the call to action is for the State of Black Maternal Health Texas Summit?
You know what? I'm going to pull on my ancestors. You have to determine what side of the history you want to be on. These are abysmal times. These are unprecedented times, but we are well equipped to bring us through. We've been brought to, now we have to bring through. And so the call to action is to bring through. Let's bring our experiences, let's bring our expertise, let's bring our passion, and let's make a really big impact for the next generation.
That Well said. Now, before we head off, I want to make sure that folks know a little bit more about you. So, why don't you tell all of our viewers about some of the services that you provide and definitely where people can find you, more milk, and more about this summit?
Yes, so you can find us More Milk on all of the socials. Our website is www.moremilk.org. So you can check us out there. You can follow us. More Milk is really dedicated in providing that educational piece that's missing. We have well-informed people, but not necessarily with the right information. And so we want to fill in to that gap. Next on my agenda is really creating some roundtables. So taking the action plans from the summit and having an action or a chart list so that we can go and get these things done. I'll be soliciting roundtable individuals that can work alongside myself and my fantastic board in achieving positive change as it relates to the state of Black maternal health here in Texas.
Amazing, amazing. Well, folks, you heard it here first. That's where you can find out more about the summit, more about More Milk, and definitely, how do people find you? LinkedIn, Instagram, where can they
Yes,
find more
all
information
those
about you?
things. I am on LinkedIn, so Dr. Tenise Hordge. You can follow me. You can also follow my lactation firm that's dedicated to clinical lactation care, Mother's Magical Milk, on all the socials as well.
All right. Well, that's amazing. Well, folks, we want to thank Tenise for her time today and wish her well with her summit. So, see you in Texas, everybody.